He's a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center just up the road in Los Angeles after graduating from Baylor College of Medicine in Houston. He's the founder and CEO of something called Diamond Physicians. It's a concierge medical practice focused on the patient-physician relationship. Diamond bypasses the cumbersome and inefficient middlemen to deliver personalized, high-quality medical care to their valued clients. Dr. James, welcome to San Diego on the AM 760 KFMB.
Hey, Chris. Thanks for having me on the show.
First thing I want to talk out the box here is this report that came out from, let's see, this is a Channel 12 somewhere, a Gannett company somewhere, talking about an analysis done about hospitals and the way they are charging. Some of these hospitals are charging 1,000% over their costs. First off, why do they do this? Second off, how are they able to get away with it?
Well, costs are supposed to be from a free market perspective. But unfortunately, because of managed care, costs have spiraled out of control. So these hospitals base all of their procedural codes off Medicare reimbursements. So if Medicare reimbursements, let's say $1,000 for a procedure, they should charge uninsured and people with insurance platforms that are outside of the network around $1,000, but they don't. They're charging as much as they can, and they're getting away with it because the entire system is so convoluted, we cannot drill down to the true cost of care.
Now, if Medicare is the standard of which everything is based, I mean, I have heard doctors lamenting for years that Medicare reimbursement is substandard, they can't cover their costs. If that's the basis, even if you are saying 1,000 times Medicare, is that the reason why they're charging so much, is because the government's reimbursement is just so deplorable?
Yes and no. Medicare reimbursements typically, they weren't low at first, but they haven't increased at the same rate of inflation. So that's the problem. They may go up 1 or 2% every year or less than that, but we're not keeping up with inflation. So that's why it seems like the Medicare reimbursements are being cut, but they're just not going up. So typically in the 80s, hospitals would charge about 1.35 times Medicare. Then in the early 2000s, it was a 3x markup, and now it's a 10x markup. So 1,000% markup, which is way too much, and they're getting away with it because consumers have no idea how much the procedure costs. And that's why we're trying to change the entire healthcare delivery system.
Yeah, and we talked about this yesterday, about how, if you look at education, we were told by the liberals, oh, if you just give taxpayer money and subsidize education, oh, that will make college more affordable for everybody. And what have we seen? As the so-called unlimited pot of taxpayer money is thrown at something, what do the institutions do? They raise their rates. Why? Because they want to get as much of that quote-unquote free government money that they can. Nothing's free, of course, you and I know this. The same dynamic we are seeing now since Obamacare passed, with these subsidies being provided by the federal government. What has happened to medical costs? They just continue to go up and up and up and up, because why? The hospitals and some of these folks inside of medicine, in particular insurance, they want to get their hands on all that money.
That's right. Everybody's got to take their cut. Insurance premiums are rising. Networks are shrinking, and access to health care is plummeting. And who suffers? It's the American people. So what we want to do is introduce price transparency into the market. We've drilled down to the true cost of care at Diamond Physicians, and we offer our clients unlimited visits, no copay, 24-hour access to their doc, plus 80 to 90% discounts on labs and imaging. So instead of charging 1,000% markup on a CBC that cost me $4, I charge $4.50. For MRI, I charge $400 instead of $4,000. X-rays are $60 instead of $500, and the list goes on and on. And that way, we're providing the highest quality care at the best price, and we let competition take over.
Dr. James Pinckney is my guest right now. He runs Diamond Physicians, in my view, part of the solution to Obamacare, part of a real solution to our medical care woes here in this country, bypasses the traitorous insurance companies. Dr. Pinckney, with the way Obamacare is written right now, Diamond Physicians is not a solution because the law actually prohibits you from actually being counted as legitimate medical coverage. Is that true?
That's true. We do not qualify for the Affordable Care Act insurance standards, and we shouldn't. We're not insurance, but we shouldn't be forced to buy an insurance product that's subpar. So, what I propose and what the Republicans have proposed is to reverse that mandate from the federal government that everyone should have to purchase an insurance policy, but let people choose the type of health care that they want. I agree. Everyone should have at least a catastrophic policy, but we should not be using insurance for the routine maintenance of health. We should not be paying for flu shots and preventative visits and urgent care visits with insurance money. We should use insurance like we use our car insurance or our home insurance. When you fill up your car with gas, you swipe a credit card. When you need new windshield wipers, an oil change, new tires, you pay cash. You do not file an insurance claim. And those same principles should be applied to medicine, which would drive premiums down and allow access to return to the status quo.
Yeah, let me explain to folks. A catastrophic loss policy is something that used to be relatively inexpensive when the insurance market was not perverted by Obamacare. It has since gone up, but when things were in a more free market-based type system, you could buy a catastrophic loss policy, which would guard you against the car accident or the cancer diagnosis or that kind of thing, and would kick in to help you with those huge costs. What Dr. Pinckney is talking about here is doing your checkups, and for me, here I am losing my voice. I went to the urgent care the other day and had to use insurance to get a cortisone shot just to keep my voice going and get a prescription for some prednisone. What Dr. Pinckney is talking about is paying a flat fee every month and having complete access to his facility. I mean, just take my example, Dr. Pinckney. If I was a patient of yours, I would be able to pay a flat rate. What was it, $145? You said, and then
right.
Say my voice started to go out. What would I do?
Well, you would call me. Doesn't matter what time. Let's say you had a show at 5 a.m. You could call me at 4 a.m. and say, "Hey, Dr. James, I need to see you right now. My voice is going out. What can you do?" I'd meet you at the office. I would assess you, give you a cortisone shot, then prescribe a Medrol dose pack. I'd have it waiting for you at the pharmacy on your way into the office, and that's that. No additional charge, no copay. You paid your $145 a month. Everything is included.
Yeah, and see, folks, this business model, and it is a business model, folks, because medical care is a business. It is not something you are entitled to, and this is something that is a service, a point of service. These doctors study a long time to get their medical license, and they deserve to charge a fair rate for their services. And what this concierge type medicine does is it puts the power into your and your doctor's hands, and that's why I think it's such a great solution. Dr. Pinckney, would you do me a favor and give me your web address, and so folks can look up what you guys are all about, and maybe I would imagine there's going to be a ton of interest in San Diego as folks are looking for alternatives to the very expensive and cumbersome Obamacare alternative.
Go to diamondphysicians.com. We have a diamond demand map. Put your information in there, and we're looking to expand across the country. So we're looking for franchisors, franchisees, advertisers, investors, physicians, anybody who's interested in the direct primary care movement. Please go to our website, diamondphysicians.com, and learn more. There's direct primary care practices possibly in your area. You can go to iwantdirectcare.com to search for already existing practices. And our job and what we really want to do, our goal, is to blanket the country with truly affordable health care.
Yeah, and how much help could you use from the folks if they needed to call their elected representative and say, look, we want the language if we're going to be stuck with Obamacare, and praise God we're not. But if we're stuck with Obamacare, to make sure that you don't have to get health insurance, but you have to get health care, and that concierge medicine like yours covered under that mandate. Would that help your business out as well?
Absolutely. That's what we're lobbying for right now. So please write your congressman, write to the House of Representatives, to the Senate, and just tell them that, hey, we want choices, and yes, insurance is important, but insurance does not guarantee access to health care. Direct medicine does. We want this to be a viable alternative and not be penalized if we choose to go with the Diamond Physicians.
Yep. Obamacare proves that just by buying insurance doesn't guarantee you medical care. Dr. James Pinckney, Diamond Physicians. It's always a pleasure. Have a great weekend, sir. Thanks for being here on the AM 760 KFMB.